Measuring wellness and well-being of an employee has been a very, very controversial issue with HR and the business. We have been doing HR Majlis for last 3 days, including today, and it started on 10th of October with the World Mental Health Day, and we had arrived at a consensus that during this HR Majlis, the core group decided that we need to do exhaustive workshop on employee well-being and wellness program. So we started on the day one with one of the COO or C-suite leader of an organization in UAE. He came and explained to us what his perspective is all about employee wellness and well-being. And then we heard from the vendor side that why well-being is important and why well-being cost is important, how you can manage the cost. Today, in this talk, we have invited a panel of speaker and expert from Boston Analytica, the leaders in analytics consulting and certification, part of the group called Boston International Institute of Certification and Assessment. The team of 4 people are here, which includes Abhijit, Eleni, Dr. Pragati, Engineering Bashir. They're going to tell us and give some new perspective that how we can use analytics to measure the effectiveness of well-being and wellness program. They will also share with us today that which all are the different dimensions of analytics, big data, and the data-driven culture, what we are talking about, how we can incorporate into the HR analytics. So let me welcome all, and before I welcome all, I would like to request our honorable chairperson of Dubai chapter, who has been inspiration behind this HR Majlis, to say a few words, and then we'll jump into the war of analytics. Hassan.
All right. Assalamu alaikum, everyone. And very good evening, good morning, good afternoon, wherever you are, in which part of the world. Thank you, Sandeep. And today is our third day, as you said, our HR Majlis. This is our first time we are doing HR Majlis virtually. This is our first time. And we have in the past 6-7 years, we have been physically involved in HR Majlises. We have been invited many industry best speakers, industry specialists, and also in the academic side, we have invited many university instructors, or I would say trainers, who have been in the past in the HR community with us. So a very warm welcome to each and every one of you. And this is our third day. And we are, of course, I think Mr. Sandeep has already requested our guest and invited our guest and introduced our guest. I would like to say also a few words about our Global Society for Human Capital Management on Global EPIC or People Leadership Awards, which has been happening from the past 12 years. And it's a big show. Every year we congratulate and celebrate with people just like you, who has been exceptionally doing well in community services as part of HR. So today as well, we would like our guest speakers, to talk a little bit on the topic on well-being and how it is important as an HR strategy to the business. So on that note, I would like to welcome our speakers. Thank you. Over to you, Sandeep.
Thank you, Hassan Badr. And before we jump into the war of analytics, we're not going to talk about deep about what is well-being and wellness. We all know it. You are HR guys. You know it well what is well-being with our wellness programs, right? So now, before we go into the wellness and well-being, let's see a small cap on what we do at Global Society of Human Capital Management. Welcome back. So now you have seen what we do in Global Society of Human Capital Management, GSHCM, and today we are here at Dubai chapter of HR Majlis, which we are organizing in this year first, and then inshallah we will have the second one by November, December for sure, as has been promised by the chapter chairperson of Dubai chapter. Now, I hand over the mic and the discussion to Dr. Pragati, who will lay down a framework for discussion on this important and significant topic, which is called Employee Wellbeing and Employee Wellness Program, which is impacting organization and the management all across the globe. Dr. Pragati Rawat. Dr. Pragati is a renowned analytics expert, and she is a public policy expert. She is currently a professor in US, and she has been working with the major organization like Infosys, and she has been with the UID program with the co-founder of Infosys, Nandan Nilekani, and she has implemented one of the vastest database you can ever imagine, for 1.4 to 1.5 billion population of people in India. And now she's based in US, and from there she is connected to us, and she is going to lay down a foundation for a discussion today for the employee wellness and well-being from the perspective of analytics expert. Dr. Pragati.
Yeah, thank you, Sandeep. So how we have planned to, along with the other colleagues at Boston Informatica, how we have tried to structure this program is basically we start with how to measure the effectiveness of well-being programs, and then move on to talk about some of the indicators as well as the other requirements for the employee well-being programs. So I wanted to start with measuring effectiveness of employee well-being programs, because I'm told that most of the members who will be joining this this conference are already HR experts, and they already have a good idea about employee well-being, what it is, and what the various programs that are run across it. So they're more interested in how we would measure the effectiveness of employee well-being programs. So talking about that, there is in fact various means by which we can measure the effectiveness of employee well-being programs, or any program for that matter. And these, if I put it on a continuum, the various mechanisms by which we can measure the effectiveness of programs, I can put it in a continuum from a highly complex to a low complexity, a low resource requirement measure. So we have lost the slide. Sandeep, can we bring back the slide? Okay, so starting from the most complex, which is randomized controlled trials or experiments that we generally know them as, I have seen employee well-being, the effectiveness of employee well-being programs being measured using experiments or randomized controlled trials. So for example, in one of the universities here in the United States, RCT was performed on a set of employees, and what we do here is we divide the employees randomly into two groups. So one of the groups will receive the employee well-being program, while the other set of employees, the other group, will not receive the employee well-being program. So we conduct a pre-test on certain indicators for each of the groups, and post the employee well-being program, we assess the same indicators in both the groups again. So, but only one of the groups has received the well-being program. So if you see a difference between the group that has received the program versus that has not received the program in the post-test, compare it with the pre-test, you can assess whether the employee well-being program was effective or not. So that is the best method available. But then in real life situations, you may not always be able to randomly allocate people into a treatment group, and a group that receives the program versus a group that does not receive the program. So randomly you may not be able to allocate. So here comes the play of quasi experiments, where you're not randomly allocating the employees, but depending on, you have two set of factories. So one factory, suppose there are two plants that you have. So one plant employs, all the employees in the one plant receive the employee well-being program, versus the other plant does not receive, any of the employees do not receive the well-being program. And then you go on with the same method. There is a pre-test and there's a post-test after the program is executed, and you assess, compare and assess the effectiveness of the program. So these are some of the more complex and more sophisticated methods. But if you do not have the resources, or you do not have the time, and then maybe you have already conducted the well-being program and you didn't take the pre-test, so you can then have just the post-test. And usually how you will do is you will ask the employees to a certain number of certain survey questions about their view, perception of the effectiveness of the well-being program. So this one is going to be very low, reliability and validity, but it will also be, it is what it is if the resources are low. So these are some of the ways in which the effectiveness of employee well-being programs can be assessed. And usually, there are studies that have used cross-sectional data, meaning that data at one point of time, and there are studies that have used longitudinal data, means they have after conducting the employee well-being program, they continue to assess the effectiveness on the same programs for a long period of time. So you conduct one test immediately after performing the program, and then you see the effectiveness again 6 months down the line and 1 year down the line. So you can do a longitudinal study as well. Depends on your organizational needs and your particular context. Now, some of the things that data sources that have been commonly used across different organizations for measuring the effectiveness of these programs, I can categorize them into three main areas. One is the employment records itself. So one of the data source would be the employment records, which will give you idea about employees' absenteeism record, or the salary hikes, which will talk about their performance, which will be a showcasing their performance. So that is one data source that is used, the employee records itself, for conducting the pre and post test. The other, again, we've lost the slide. Can we bring back the slide, please? And the other source is health records. So again, here there are various ways of obtaining the health record. It's either the insurance claims, or it can be medical spending. It can also be biometrics like blood tests. Those are also performed for pre and post test. So before you are starting the employee well-being program, employees' blood is drawn and certain tests are performed to identify their physical health, where it stands, and then post-test again you perform the same test to assess their well-being. And then the third set of criteria is self-reported health metrics. So you ask the employees about their lifestyle, about their whether they are a smoker or a drinker, about their nutrition, their fitness regime, their stress levels, their job satisfaction, things like that. So here, most of the indicators of psychological indicators, social indicators that are generally talked about in the well-being programs, that's another source of data for pre and post test, and this is generally self-reported by the employees themselves. Okay, and then there are other records for health, right, like gym records, or whether they participated in some marathon, things like that. So these are some of the data sources for the pre and post tests that I was talking about in the experiments or quasi-experiments. So having talked about these various methodologies that are available and different data sources, one of the things that I want to talk about is, or draw your attention towards, is that defining, many a times it is reported that the employee well-being program was not effective at all. But that could be a reason of not defining the well-being, employee well-being properly. So have you defined what is employee well-being in the before you start measuring the effectiveness? So that is one important criteria. Like, how do you define employee well-being? Have you defined it clearly enough and measure in a way that it can be measured? That is important, and it will vary from organization to organization, based on the context of your organization. And the second is, can we bring back the slide, please? And the second is, whether we are, how are we measuring the employee well-being? Are all the how do we operationalize every aspect, the physical well-being aspect, or the stress? How are we measuring stress? So defining what is employee well-being and then how you're measuring it is going to make a big difference in when you, whether you get a result, a positive or a negative result of when you measure effectiveness of the program. The other important thing that we have to know here is that these various indicators interplay with each other. So, for example, after an employee well-being program, if someone says that they are sleeping better, so it's not just that they're sleeping better. It also means that their stress levels have gone down. Probably their depression levels have gone down. Probably their productivity has improved in the organization. So it's not just the sleeping well indicator, but the other indicators are also being improved. And therefore, how do you measure and how do you assess the effectiveness of the program in a more comprehensive way? If you if you define it well, if you measure it well in a more comprehensive way, and are able to see how the different indicators interplay with each other, then probably you will have better results of effectiveness of employee well-being. So now I've talked about this, given some idea about measuring effectiveness. I want to talk about a little bit more on the indicators, which I think Abhijit is going to be doing. So I hand it over to Abhijit now to talk about what are the various, generally talked about indicators in employee well-being. Over to you, Abhijit.
Thank you so much, Dr. Pragati. That was quite useful. Before I start, I have been in the industry for such a long time and has been an entrepreneur for quite some time. One of the key questions that I have always asked myself is that while we spend a lot on employee wellness, arranging healthcare, education, social environment, what happens when at the end of the day the employee takes all the benefit and leaves? That's a cost that has been incurred without a return in hand. So I think before we move ahead, we spend some time to understand what is it that we are trying to measure and for whom we are trying to measure. Who is it who should ultimately benefit from the employee wellness program? Because if we are clear about that, then we can prepare a better framework in terms of measuring and tracking the employee well-being. So let us look at it from the employee's perspective. Anything done for the employees is always a bonus because it is over and above what they get as a monetary remuneration. The whole objective of the employee wellness program, from my perspective, would be that it should add to the shareholders' wealth. Now, how it can add is one of the ways is the productivity of the employee should go up, the absenteeism of the employee should go down, or for that matter, the cost of health should go down. So the more claims I make as an organization towards insurance, my premium for the next year goes up, and that is substantial for a larger company. That can be a one good objective. That is my premium for insurance per head is going down year on year. So if I keep this in perspective, then we can have a discussion that what are the dimensions and how do we go about building up a framework around that. And another point of discussion would be, and I would like to know the opinion of of the rest of my colleagues who are present here, because each one comes with a whole lot of experience in their own organization, sometimes as an employer, sometimes as an employee. Is it only health which we are talking about as employee well-being, or we should take a more holistic view, because that changes the framework that we are making. So it is not just the health parameters which are more quantitative in nature, but also the soft factors that we need to quantify to get a correct framework for measuring the employee wellness. Uh, Sandeep, if you can put on the first slide, which talks about the dimensions of employee wellness. Yeah, the next slide. Yeah, so here I have put down a few of the dimensions. More or less, I think we have covered almost all, but I would definitely like an opinion about whether these should be included or not from the esteemed panel which is present here. Sandeep, why don't you start? What, as per you, and you have been in HR for a long time, should be the dimensions for employee wellness?
Yeah, say again, Abhijit.
So, what I wanted to know, you have been heading HR in multiple companies. I wanted to know your opinion
Right.
whether health should be the only parameter for measuring employee wellness, or we should take a more comprehensive approach towards it, where we include the other factors also.
Well, employee health is one of the aspect,
Perfect.
that physical health part. Then you've got other aspect of the health, the psychological well-being, then his surrounding, what kind of a safer workplace the person has it. And the day one, we had a very nice discussion with Ali Al-Suwaidi, if you remember, Hassan, that what kind of a synergy it is there between the management and his team members, the workers, how safe the people they feel at the workplace, how safe the worker they feel about that their workplace is stable, and because a person's psychological the stressors the person brings at he gets at workplace, it gets disseminated to his family as well. When the workplace is not safe, there is a issues and challenges. So it's not just a well-being, where we conduct, hey, let's have the workshop on measuring your blood pressure, and organize some blood camps, and then see that are you fit, are you body mass index in the high or low. This is just a one small component which I feel like we need to take into consideration whole gamut of component which will encompass employee wellness and well-being. That's a very comprehensive word. And then we need to factor it into the smaller sizes, bits and pieces sizes, and then created this collage, and then collage must home to one specific aspect which will create a KPIs. Yesterday we were discussing about why can't we have a KPIs for the business leaders and the CEOs, not only in HR, but the business and the CEOs. And then this can be one of the critical success factor for employee engagement programs. So it is, or it could be one of the components of employee engagement program, or it could be standalone, one of the key component of the human capital measurement index of an organization. So this is my thought process from the point of view of employee well-being and mental.
One more issue here is that, and why I'm starting with the objective for employee well-being, is that there has to be a context to what we are doing, and context means, say, I would bring in Eleni at that time. She has led a lot of strong campaign management teams, both on ground and off ground. Now, if she's heading a team, I would like to know if she has been allocated a particular cost for well-being of her set of employees. What is it that she's expecting in return when we evaluate the performance of the team at the end of the year? Because at the end of the day, she's a P&L account holder, and everything that we spend on employee wellness will go into her cost account. So Lady, what would you like to seek out of the whole employee wellness program?
Thank you, Abhijit. Yes, there is always a budget that
Eleni.
organizations.
Eleni, before Eleni goes live, a few words about Eleni. Abhijit is a consultant, he's an expert in analytics. So you've got four analytics guru with you. Huh? And Eleni is one of the fantastic, very senior analytics expert, and she has got extensive and a huge banking and financial sector analytics, and she is phenomenal analytics leader. And we are, as HR professionals, are very proud to have her on this forum to understand the dimension of analytics from the point of view of analytics expert. Yeah, Eleni, sorry.
Thank you so much, Sandeep. Yes, so to reply to Abhijit's questions, yes, the organizations, at least the corporate, the banking organizations I have worked in, the financial ones, they always give a budget to the heads of the departments to spend on their teams for their wellness programs and make sure their teams are happy and always be next to their employees to listen every feedback from their side, everything we can improve further. And of course, at the end of the day, all these are measured with employees' productivity and what are the results the team has presented to the management. So this is the question from Abhijit. Now, if we want to, I would like to talk a little about people analytics. I would like to talk about people analytics because until now, in all our previous sessions, we have discussed about marketing analytics. And as marketing analytics has revolutionized the field of marketing, HR analytics can also help the HR. So it can enable HR to make better decisions using the data, create business case for HR interventions or wellness programs, test the effectiveness of these programs, and actually HR move with the help of analytics from an operational partner to a tactical or even strategic partner. So analytics can enable HR professionals to make data-driven decisions and, of course, measure the effectiveness of their HR policies. If I want to put it in simple steps, what do we need? First of all, what do we need to apply HR analytics? The same that we need to apply marketing analytics, but just for different people, not for customers, but for our employees, which is very, very important and a big investment for an organization. So first thing we need is to centralize our employee data, to make sure we have all the data of our employees in one system, in one place, and not in different sources. This is step one to start with. Second, we create an HR dashboard where everything is there. We have reports, we have things to monitor, easy and quick access on everything we need to see, and not searching in different places. Then we need to build analytical capabilities. We need strong systems to make sure we create queries, we create reports or new KPIs we need to monitor. We identify with the management what are the targets and what are the objectives of the people analytics we want to apply. So what do we want to measure? What do we want to monitor? What are the wellness programs we want to have and the effectiveness we want to monitor? Then we put HR analytics into practice. And of course, we always continuous monitor and drive improvement. For example, simple KPIs we can monitor. How high is our annual employee turnover? Do we know which employees have high probability to leave the organization the next year? Which of these employees we would like to retain, or they are valuable for the company and we wouldn't like to lose them? So simple things like this can be easily answered using analytics in HR, using people analytics. To say it differently, as we discussed in our previous section about customer life cycle in an organization, where in reality we analyze the customers' needs based on their life stage, based on their income, and accordingly we build journeys for customers in the organization and personalized communications, exactly the same we can do for our employees. They are valuable. Customers are valuable. Employees are also valuable. We have employees based on their life stage, based on their position in their organization, and based on the stage they are. Are they in the onboarding stage? Are we going just to acquire them, so send them an offer? Are they already in the organization, so we need to make sure they are happy with us? So this is the customer life cycle management, or the employee life cycle management we need to have as a strategy, as an organization, based on our employees' needs, proactively, measure their KPIs, measure their happiness, have policies in place as HR to make sure some things for them are easy or straightforward, have access in anything they may need from HR side, and all this is an ongoing actions we may need to do if someone we see that has stopped being satisfied or has high probability to leave the organizations. So for me, employee life cycle management is a very important part, and I would recommend, and I would say, in my opinion, every organization should have it in place. Correct policies, correct processes, employees from the onboarding stage, before actually, how we send the offer, what offer should we send to a married employee in a senior management position or in another position, what needs they have. Maybe they need better insurance if they have family, if they are simply different insurance, all these things. Then how do we onboard them? What is the onboarding stage? Then how do we make sure in the position they are happy with the organization, or happy with their manager, or happy with their ex-colleagues? All these things have to be there, data have to be there, analyze them all the time, and always make actions to improve further and further and further. This is how, in simple words, we can apply analytics, people analytics, to improve our employees.
Yes, Abhijit.
Okay.
Now we have passed 30 minutes and we need to give some concrete structure to the HR
Now,
people.
there are two parts that we will be discussing now.
The warming up is
So
done.
there are two important parts that we will be doing now in the rest of the 30 minutes. One, yes, we sat down as a team and created what should be a broad look of an analytics-driven employee wellness strategy, because that will give us what we are trying to measure, why we are trying to measure, and how do we measure that. And then I will wrap up the session with a broad plan of making a quantitative employee wellness measurement system, or a quantitative employee wellness strategy. Uh, can we have the slide on the dimensions, please, Sandeep? It's
Yep.
the sixth dimension. Yes. No, the previous slide. The previous slide. Perfect. So, we were trying to create a framework, and Dr. Pragati, Engineer Bashir, me, and Eleni sat down to give a context to the whole approach. So we came out with six different success factors. One, we agreed that yes, we should have a 360 approach to wellness, irrespective of how much of it can be measured, or we can create proxies to measure some of these, but it has to be a 360 wellness program. The second, it has to be customized. Why customized? Because not all companies have the same objective. Not all companies have the same organization culture. So the program has to be custom made for individual organization, as well as, if possible, individual departments. And we will talk about it a bit in a while. The third is the transparency. And this is something which is not exactly quantitative, but the more clarity the employees get in terms of what we are measuring and why we are measuring, it will add to the probability of success of this whole program. Fourth, definitely goes without saying, is measurability from all perspectives. So we have to measure how the company benefits out of it. We have to measure whether the program itself has been effective or not. We also have to measure whether the employees have been able to take benefit of the program or not. And at the same time, each individual department derives the maximum value out of the program. The next is the accountability. There has to be, for every program and for every aspect of the program, there has to be a team or individual accountable, and it has to be attached to their own KPIs to ensure that the wellness program reaches the objectives that we set. And the last one is inclusiveness. All of us were in agreement that employee wellness program is not just a prerogative of the HR department. The HR department can initiate it, the HR department can facilitate it, but because the beneficiaries are spread across the organization, there has to be a participation from all of them, so that we ensure that it is not just an entertainment program or a benefit program like any other component of the salary that we are talking about. It's a holistic approach to bring the organization performance levels up. Now, the engineer Bashir was a very, very important part of it, to put a top-down approach to the whole approach towards making a framework. I would definitely like to hear engineer Bashir that, how important is it to look from a top management's perspective while designing an employee wellness program.
So before Engineering Bashir he replies to Abhijit, your cue. Let me give a brief introduction about Engineering Bashir. Engineering Bashir Hashim is one of the very renowned and well-known name in analytics domain and a consulting domain in Saudi Arabia. And he has held very, very sensitive and very productive appointments with the ministries. And he has a hands-on expertise in analytics, and he is known, and I know for sure that he is regarded as very and a great expert in analytics in Saudi Arabia. So we are great to have you, Engineer Bashir, here.
Thank you very much, Sandeep, for the warm introduction, even though you gave me a little bit more than I deserved. But pushing back on Abhijit's point, why does management care about well-being? The bottom line is, without well-being of employees, the entity, whether it's government or a private sector, will be lost, whether in intellectual property or physical, to that entity that resides within the local area or international. So when you design the well-being program for employees, what we do is there are a number of parameters: working hours, level of stress, level of jobs required, so on and so forth. And when we measure that, we have systems that can go into. However, the accuracy of these depend heavily on the employee himself. HR needs to define whether or not to take averages, separate jobs or separate onto different levels of analytics in order to figure out authenticity or figure out impact of the well-being program that's being implemented. What's the payback on all of these investments for well-being? It's an intricate job that requires multi-level cooperation between top management, HR, section heads, managers, supervisors, and employees themselves. It also requires a culture where openness is available, and honesty and simple acts of being positive towards improving the entity or the environment itself. To improve the entity needs to exist. So I know I'm diverging a little bit off, but to understand why these well-being programs are established, why companies pay money to ensure these programs happen. At the end of the day, without the people, you lose that entity. And if you have no people to run this, especially connected to management will not understand why they're failing, why things go wrong. Am I offside, Sandeep?
Yes,
Sandeep, are you with me?
yeah. Thank you so much, Engineer Bashir. So now we will go to the framework that we tried developing, and all of us agreed that there cannot be a single framework for all the companies. Uh, it's not a panacea. It's a very custom developed thing, but yes, we can put a structure to it, which can be used as a basis for creating an analytics driven employee wellness program for everybody. Sandeep, if you can go to the plan slide, the framework slide. Yes. So what we have tried to do is we have tried breaking up the framework into three key parts. The first is planning, the second is the preparation, and third is the measurement. We cannot reach the third part before we complete the first two parts. Within planning, we have to start with putting a context to the whole wellness program. And the context has to come from three, four dimensions. The first, we have to clearly understand that what is our business? What are the business processes involved? What is the nature of employees or the nature of work in different departments that the business is involved in? Because there is a difference in the kind of expectation depending on what kind of employees we are talking about. So that understanding of the business and the business elements have to be very clear. The second thing is we should try and understand what is it that the management expects out of the program. And if we are trying to define it in terms of we need happy employees, then we must define what do you expect from the happy employees. Or if you are saying that we need healthy employees, then what is it that we are trying to get out of healthy employees? It best possible way is to describe it in monetary terms. If it is at least not monetary terms, it has to be a close associate which can be converted into a monetary terms. The third is we must know what is my as is status, because we are taking on a program. We need to travel a journey. If we don't know where we are starting from, we'll never be able to understand where we are reaching. So that as is context is very, very important. We started with Dr. Pragati explaining us that what are the various ways that as is can be obtained. It can be employee surveys, it can be employee performance, it can be the health results from the past years, the insurance claims data. These will give us an indication of where we stand now and where we want to reach. So you can understand if we are an organization who have never ever claimed any claims from the insurance department in the last 3 years, there is no point spending more money on healthcare, isn't it? We are already doing quite well from the health perspective, so we need to focus on something else. Or if we see that there has been a substantial amount of claim in the insurance department, and most of it has come from, say, lifestyle related diseases. So that will give us a context that where is my average employee height to weight ratio standing, where is my BMI standing, and where do we want to reach. So that context to the wellness program is extremely important. That gives me the initial drivers. Once we have decided on the drivers of the employee wellness program, we must understand what are the factors which are taking these drivers ahead. So as I told, one of the drivers can be health. The factors which are taking it ahead is my heart condition, my strength condition, my overall well-being. But these have to be explained in a numerical manner, or at least which can be counted or converted into a numerical statistics. Once we have done that, the second most important part of planning is to get management support. It is not just that we need a signature on the paper from the management. A management support helps us communicate the objectives and the expectation of the program to the whole organization. So we cannot end a plan before having a management support. Once we have obtained the management support, the third thing is to establish a measurement and prioritization of factors. So as we told you that if we do brainstorming session, the employees themselves will come up with thousands such initiatives that can be taken within the organization, and anybody whose suggestion is not entertained will figure in that set of unsatisfied employees which you don't want. So we need to create a mechanism where we not only measure but prioritize the factors, because at the end of the day we will have limited budget and we will only take up top 10 or top 15 initiatives for the year. We have to see what is the benefit that they are giving. So we'll have to prepare an ROI framework, that if I am spending so much of money on health, what is the effect that it is producing on productivity, absenteeism, etc. The fourth and most foremost is establish a wellness committee. The wellness committee has to be pan organization. It cannot be from only HR department, because the responsibility has to be divided, the measurements have to be divided, and each one participating in the committee has to be attached to their own KPIs. Once we have planned these things, we are in a best position now to move forward in terms of preparation. Any preparation has to start with budget and approvals. The budgetary approvals is dependent on few key factors. One, what has been the claims earlier? Can we reduce the costs? What is the sales expectation we have for the next few years? And how much is the management willing to pay for that? Fourth, what are the mandatory requirements from the government that we have to include in the budget? So you can understand that insurance coverage is a mandatory requirement in most of the Middle East companies. So you don't have a choice. You have to go with that. But the mandatory requirement says a minimum amount of insurance. Anything over and above that, it is the benevolence of the shareholders that we are talking about. But the budgeting has to be done with a clear view on ROI. So if this is the budget, what is the quantified returns that the management is expecting from this program? Once we have done the budgeting, we have the constraints in place. So we cannot go all out. Now, I have seen companies doing weekend parties as a part of their wellness program, but then you have to have a budget for that. So now that you have the constraints in place, define the component of the program. So are we investing in, say, a non-smoking environment creation component? So if it's a non-smoking component, then as I say in the third point, set target. So if it's a non-smoking thing, then how many smokers we have at this moment in the organization? What percentage of the total employee base is the smoking population? And what is the target that we are trying to reach in the next 1 year or 2 years program? And what are the programs that we need to build upon? So for each identified factor, we have to build a set of components and set targets for that. Once we have done that, we have the as-is position, we have the targets. So we are set for a very quantitative approach to my employee wellness program. Fourth is build a strong communication plan. Whatever we are planning in terms of quantitative approach on paper adds no value to the organization if it is not communicated well into the organization. And our budgeting has to take into account the marketing program, internal marketing programs that we are going to run. Once we have done that, we are in a position that roll it out on the ground. A lot of creativity goes into it. We being very, very quantitative, analytics driven people, we are not deep diving into the creative aspects of it. But however, before we conclude, we come back where we started from. The last and the most important part of it is measurability and tracking. We not only measure, but we track the factors, the individual component success factors, also the ROI it is bringing. The moment we see that the return on investment is not in commensurate with the whole budget that we are allocating, it will be extremely difficult to justify to the top management. Now, this is our perspective. It would be interesting to get it evaluated immediately from somebody who has spent time in HR and who will be the one who will be standing with the plan we are talking about in front of the top management and the board and try to convince them. So, Nitin, you have spent a lot of time, in HR, getting approvals for these programs, and even Sandeep. Why don't you tell us that what will be easier for you to, defend such a framework, or would you like changes in the framework? Perfect. Yes, Sandeep. Sandeep, you muted.
Two things. One is we are standing at 15 minutes. We've got only 10 minutes to go.
Okay.
So, and second,
Wrapping now.
we have a question
Perfect.
before we answer. So the question is from Leila Al Jawadari, and she says that she's not an HR guy, and she says that what are the main features of a successful wellness program?
Excuse me.
What are the main features of a successful wellness program?
The features. So we
Yeah.
can go back to the previous slide that we were talking about, the sixth.
So who's going to answer? Who's going to answer the question?
You called me out.
You'll
Yeah.
answer?
Okay. Okay.
Yeah. You want to answer? Then we can go to the question
Yes.
of
So
Abhijit back again.
we'll start with what Abhijit asked. One of the most important thing is like you talking from pure analytics perspective, but when it comes to performance and especially the cost part of it, it is very difficult to prove that any of these programs, wellness programs, are directly contributed to the success or some monetary benefit. If there is a monetary benefit, it will be very difficult to prove. I was thinking when you were talking about that, so I was always thinking. So because there are a lot of factors like employee wellness is the fatal metric. You can say it's must have. Then whether other environment like support was available, whether knowledge was there, whether the infrastructure was there, whether the processes were in place, whether the tools or the government policies were in support of whatever we planned. So how we are pushing wellness program. It is like a must-have program nowadays. I give an example of airport security. My father used to say that earlier we used to just go to the airport in 10 minutes or 15, 20 minutes. They used to board the plane. Now we have more checks, more security, more 3 hours back before you have to be at the airport and all those customs check and baggage check. But it's more cost, more money, more time. But still, it is important people appreciate that. So that wellness program is a must-have. So in the organization I've worked with or I've heard about, it's very difficult to put the entire monetary benefit to a wellness program. However, it is thanks to COVID situation, now the emphasis is more on the employee well-being and wellness.
So shall I, Sandeep, you're again muted.
Yeah, and Abhijit, I would like to add here is, of course, you will not have 1 + 1 2, but you can always have logic of 1 + 1 11.
Absolutely.
So it's a hypothesis when we create. There's a logic. When we do a program, there's a logic behind
Absolutely.
it, right? Then you can see the programming in the front.
Absolutely.
Okay. Like in the marketing also, you create a hypothesis, then only you go for a survey, and then you can go for your initiatives. The same like this, you can have the same hypothesis you can create
Absolutely.
for the HR functions or for the wellness and well-being programs. And he's saying that if one does not click, okay, 1 + does not go, then the person is not engaged. If the person is not engaged, then the hypothesis is he'll not be productive. If he's not productive, then his life cycle will be short. So, you can definitely create. You cannot have 1 + 1, straight away to 2, which none of the analytics has. The basis of the analytics is the hypothesis and the logic. And that's the very basis of the analytics.
Interesting question. And I don't think there is one answer to it, but one way of looking at it is, say, I told you that in the program, the first step was to create an as-is situation. So we agreed upon what is the as-is and the trend. So for example, say I'm trying to reduce absenteeism. Now, whether absenteeism is contributing to the revenues is the secondary matter. First, we will have to see whether the employee wellness program has reduced absenteeism, and that will not be difficult to see because I know the absenteeism figures for the last 5 years. If the percentage increase or decrease in the absenteeism figures are showing a significant difference, then there is nothing else to contribute it but to the wellness program that we are running, isn't it? Now we will see that what has been the trend in the revenues. Now, two things we do is, in terms of mathematics, is we deseasonalize the data and we remove the effect of economy from the data. So there is a natural trend up or down with the economy. So we remove that and then see if there is a difference. Now, if I have removed economy, if I have removed the seasons, then you can only attribute the increase in revenues to the employee performance, isn't it? Now, because absenteeism is one of the factors, you will have to give weightage to that. So there cannot be a direct measure, but there are measures to measure everything. Everything in this world can be quantified, and it helps because at the end of the day, every expenditure has to roll up on the cost side, and the person who is spending the money has to show something on the revenue side. So
Hassan has something to say. Abhijit, just Hassan has something to say. Yeah, Hassan, yes.
Yeah.
Yes, sorry. Just wanted to come back to the question. The question is, what are the main features of successful wellness program? Features.
So, Sandeep,
and we have got one more question from Julie Christie, and she is part of the core group. And she says that anxiety, depressive symptoms don't necessarily show up in the medical cost. There's a stigma attached to it. It will show up in the attendance reports and reduced productivity. That's what we're talking about, the hypothesis and the logic.
Yes. So this is what the factors, how factors help. So we broke the mental health into various factors. So you cannot really measure depression, but definitely you can measure the effect of depression on the presence of the employee within the organization, or the attentiveness of the particular employee. How many mails they are replying to, how many times they are attending their calls. These are all quantitative factors which can be attributed to how attentive the employee is in the organization. Sandeep, go to the next slide, the hexagonal slide. So these are the features that we thought will go into making a robust employee wellness program. So the first thing that we spoke about was a 360-degree approach. So we are not only looking at the physical health, we are also looking at mental health, the social well-being, the financial well-being, etc., etc. So we identified around 10 factors. All of them will be taken care of in this program. The second is the customization. So a very sales-driven organization will have a very different kind of grid than, say, an NGO or a government organization, where the objectives are a little different, the nature of employment is a little different. Even within the organization, within a single organization, say an R&D department will have a very different kind of employees whose wellness needs will be very different, rather than a shop.
One minute to wrap it up.
Yeah, so these are the 6 parameters: transparency, measurability, accountability, and inclusiveness. So I'm making a program which is numbers driven. I'm also attaching the measurement factor, and I'm also attaching who is accountable for that. The last is that we must include everybody. Otherwise, this is not a program which can be driven by one single department or a small group of people. Yes. Sandeep.
Abhijit, if you are done, I think so. We are almost done with the program. Anything you would like to add, Engineering Bashir and Eleni, to conclude?
No, I think
No,
Abhijit
I have not.
mentioned.
Abhijit took it all.
I just represented it.
Thank you, Abhijit.
Hassan, you would like to do a conclude it and give a vote of thanks to the
Okay, you want me to do? All right. So I think thank you, everyone. Before thank you, just wanted to tell you that Dubai itself, as a city, is doing Dubai Fitness Challenge as wellness. And Sheikh Hamdan's, he started this in, I think, in year 2017, and there was lots of walk around runs, and there were so many hubs of exercises to keep the wellness on, and again in 2020 it's not stopped. In October, I think 30th October, they are starting again here in Dubai for 1 month, 13 to 30 days for 30 minutes of activities. So this is what Dubai is all about. It's giving the wellness and well-being for not only employees but for the community. So, and here we should from this we should learn and implement at our organization part. So that's my small comment I wanted to add. So, and also I would like to thank our guest speakers, Elena, Abhijit, and engineer Bashir Hashim, and also our core team member, Mr. Nitin, to be part of today's HR Majlis as the last and the third day of HR Majlis. Over to you, Sandeep. Thank you.
Thank you, Hassan Amin, the chapter chairperson of Dubai chapter of GSHCM. And this was the third day, and with this we conclude the HR Majlis of Dubai chapter, and we look forward to Hassan Amin next HR Majlis soon. If you want to know more about employee wellness and well-being, quantification and analytics and big data and other things about, you please send your comments in this video, which will be uploaded in the which is there and which will be uploaded always will be there in the LinkedIn, and it will be also there in the YouTube. You can send your comments and all. We'll be very happy to share the slides and other details. And if you need to know more about it, and if you want to connect personally with Abhijit, Elena, Eleni, and Engineering Bashir and Dr. Pragati, we'll be very happy to connect you with them. Thank you again, and wish you a very, very good evening and have a nice day. Look forward to meet you again.
Thank you.